Hey, it's Dr. Wyrick here, and to address one of those common questions that I get, what about the back? Do stem cells help the neck and the back? The short answer is yes. The long answer is here's how. Okay, so if I were to take your x-ray, take your MRI, it may look something like this. So here we have L4 in your low back, L5 in your low back, and then S1 down into your sacrum. The story would be very, very similar if we were talking about the segments in the cervical spine. But you take these x-rays and you look at things like osteoarthritic changes where there's some bone spurring that's happening, some disc narrowing that's happening, and we look at those affected areas. Now, when we do stem cell therapy, what we'll do is we're not going to go into the actual spinal canal itself for safety reasons, clearly. So what we'll do is our nurse practitioners will inject into the muscles that are above the affected area. So let's just say that the main area is an L5-S1. So what we can do is we can come in here and inject into the muscles on both sides of L5-S1 and maybe do half of the injection here, half of the injection here is typically what would happen. Now, what we'll do is when you sit down and meet with our nurse practitioners, they will discuss where those areas of degeneration are. They will talk to you about where it's worse, if it's worse on one side versus the other. We'll make sure we get all the information so what we're doing is the safest and most effective as we can, because if we put these stem cells into that musculature, they can migrate into the areas. This is how we've helped a lot of people with osteoarthritic issues in their neck and back. Hope that's helpful. Hope to talk to you soon. Thanks.